This week marks the one-year anniversary since President Biden signed the Inflation Reduction Act and includes several provisions to reduce the amount many of you pay for drugs. We spoke to an expert about its impact.
I'm here with Dr. David Wilcox. He is a health professional who wrote a book called How to Avoid Being a Victim of the American Healthcare System. He also just wrote a paper about lawsuits pharmaceutical companies have filed over the Inflation Reduction Act. So David, thank you so much for joining us today.
Thank you, Kari. Thanks for having me.
Yeah. And so today we want to talk about the Inflation Reduction Act. This week marks the one-year anniversary since President Biden signed the act into law. So we want to discuss today the provisions around drug negotiations. So let's start with that. It's my understanding that there will be 10 drugs that we'll find out about come September 1st. And what's going on with those drugs right now, and why is this such a big deal?
So we fully anticipate that those drugs will be the most costly for Medicare recipients. And the reason why it's such a big deal is because Medicare is the largest healthcare payer, and they have never had the ability to negotiate drug prices before. Now, Medicaid can negotiate drug prices, but Medicare cannot. And so this is a big move, and the pharmaceutical companies are going to fight tooth and nail to make sure that this doesn't occur or occurs on their terms.
Right now, there's a couple pharmaceutical companies that have filed lawsuits against the government. What can you tell me about those lawsuits?
Those lawsuits are interesting because this isn't a model the pharmaceutical companies are unaware of. I mean, you know, United Healthcare or Blue Cross Blue Shield, they negotiate drug prices for their members. So they're just, with Medicare being the largest healthcare provider, and it was open season, or payer, I'm sorry, and it was open season on prescription drug prices before, where they could do pretty much anything they wanted. I mean, they tripled, brand name drugs tripled between 2009 and 2018, much higher than the rate of inflation. They don't want anything biting into their profits. And that's exactly what this lawsuit is about. If they can stall it, if they can not negotiate for a couple more years, and maybe a new administration comes in and blows this Inflation Reduction Act up, then, you know, that's what they're banking on.
Do you think that could actually be possible, that this could be reversed?
Yeah, I think it could be. Yeah, like anything else in the political world, right?
For those companies, they argue that the reason they are filing these lawsuits is because this is unconstitutional, that this will hinder research and innovation. What's your thoughts on that?
Well, it's a long shot. They say because of the Eighth Amendment that the taxes that they would face if they didn't comply with this are unconstitutional. That's a long shot for sure. What was the second part of your question?
They say it will hinder research and innovation.
So that's an interesting point. So research and innovation is funded quite a bit by the government, by your tax dollars. There's no country in the world that pays as much as we do for prescription drug prices, and they keep going back to research and development, right? But if that was the case, why aren't they charging the rest of the world for research and development? Why does the American public have to pay for research and development? It's because they want to make more profit. They've got a very good gig here, and they know that this is the beginning of the end, because it's 10 drugs in 2026, and then it progresses to more drugs. And so they're going to fight it. Like I said, they're going to fight it tooth and nail. Will they win? Probably not, but I'm sure it'll go all the way up to the Supreme Court before we get a decision on it.
And bottom line, how much could Americans save who are on Medicare? How much could they save if this all went as planned, where the government could negotiate prices of drugs?
Billions of dollars. They could save billions of dollars. Hey, one other point, Kari, is that if the lawsuits fail, they're going to pass the costs on to the rest of America. So the seniors will be good because of Medicare, but the rest of America are going to see their drug prices go up because they're not going to take a hit to their profits.